You tell me about your strengths and weaknesses.
Sir, my strengths are I'm hardworking, I'm disciplined, and I'm honest. My weaknesses are I'm a little workaholic.
Tell about your city.
Sir, uh, I am belong to Guntur, and it is also known as medical hub because it is a wide range of it is a wide range of area with medical college and super specialty hospitals, and it is also known as educational hub because there is a lot of there is a lot of colleges. It is agriculture of um, Agriculture College of Bapatla or Engineering College of Guntur, Guntur Medical College, and there is a lot of CA students which come across the state to come to the Guntur, and they because there is a prestigious institutions like Mastermind and Satyam Institute. There's different type of institutions available in India. In Guntur. So it is called Medical Education Hub. It is also known as a chili city, as it is a largest producer of chilies, and it is there is a there is also production of crops like cotton and
Enough. How are you feeling with PD classes?
Sir, how are you?
How are you feeling with PD classes with us?
Sir, very good, sir.
Okay.
I'm improving. First I don't have any confidence about speaking to interview or anything. I didn't have any confidence to speak in of anyone, so I can speak now with a little bit of confidence.
Okay. Chaliye, doctor, what is Parkland's formula?
Sir, Parkland formula is it's used in Burns disease. It's a 4 ml into total body surface area into weight of a person.
Okay. Tell about shoulder dislocation.
Sir, shoulder dislocation can be of, there are different types of shoulder dislocation. Most common type of the shoulder dislocation is anterior, and it can be happen while we are holding any tree, or it should be an abduction and external rotation, and most 90% of the dislocation is shoulder dislocation.
Okay. Tell about trench foot.
Sir?
Trench foot, frostbite.
Sir, the trench foot and frostbites are different, sir. Both are different. The trench foot is not a freezed cold feet, but it is occurs in when we in the long cold temperatures, that is up to 16 degrees. But in a frostbite, we have to be in a 0 degrees.
Okay, tell me the types of joints.
Type of joints, sir. We can consider, it is divided into two types. Generally, joints can be divided into two types. One is histological and functional. Histological can be of fibroid joints and this synovial joints and connective joints. So what happens means functional joints, it can be of movable joints, immovable joints, and little movement joints and wide rotating movement joints. It can be of क्या होता है ना joints, there are different type of joints based on anatomy also, like hinge joint, pivot joint, ball and socket joint.
Okay, tell me the range of BMI from low to extreme.
Sir, for males, it considered as 9 to 24 is a normal BMI, and from 24 to 30, it's obese, and from above 30, it's over. Sorry, from 24 to 30, it's overweight, and over the 30 is obese. And for females, it's considered as from 18 to 25 is a normal BMI, and 25 to 28 is overweight, and above 28 is obese.
Tell me the gland controlling BMR.
Sir, BMR is basic metabolic rate, and it is controlled by thyroid.
Okay, tell me about eclampsia and pre-eclampsia.
Sir, preeclampsia is a condition, sir, it is defined as being being a BP of more than 140 systolic and 90 diastolic in pregnant women more than 20 weeks with any end organ disease, or with any end organ disease like liver disease, or neurological diseases. And eclampsia is considered as seeing first clonic tonic seizures in the patients with the preeclampsia patient is called eclampsia.
Okay, what is phimosis management?
Sir, phimosis management can be, if it is not that much painful, it can be lived as by reassuring the patient. And if it is painful, and we can circumcise the area of, we can circumcise the foreskin, and it can be, if there is no problem, it is not painful. Generally, the symptoms of phimosis is burning urine and the bleeding also sometimes. So if it is not if it is asymptomatic, then we can treat it by assurance.
Okay, then what is paraphimosis management?
Sir, paraphimosis is a condition where the conical, the glans penis, the penis will be having the glans penis, and the base of the glans penis is called the conical of the glans penis. So if the conical of the glans penis is tightly fused with the foreskin, it is called paraphimosis. Generally, it is a painful condition. So we can manage it by opening the, there is a different types of management. It can also be done by circumcision, or it can be treated with retracting of foreskin and holding it for 5 to 10 minutes. It will automatically resolve.
Okay, what is filariasis carrier?
Sir, filariasis carrier is Culex, sir. Culex mosquito. It mostly resides in urban and non-urban, semi-urban areas.
Okay. Tell me the difference between amoebic and pyogenic abscess.
Sir, generally the abscess in the liver, they are talking about the liver abscess, sir, here. In the liver, there will be two abscesses, pyogenic abscess and livergenic, amoebic abscess. So the pyogenic abscess is mostly of internal organ related, like bile tract infection, gastritis infection, or infection through portal vein. So these are the reasons of pyogenic. That's pyogenic means pus included, and amoebigenic means we can consider it as a tropical country liver diseases, like diseases where we have a little bit unhygiene conditions, like this. We can see it in dysentery, and we can also see in this malaria also. The parasite will be resides in the liver only. Then also we will get amoebiasis and amoebic dysenteries. Then we can have this amoebic liver diseases, liver abscess.
What do you mean by Murphy sign?
Sir, Murphy sign is when we see in inflammation of the gallbladder. Sir, we will put a hand in a subcostal area. Subcostal means below the lung, where the liver resides. We will press we will press it, and by we'll ask the patient to inhale and we will press deeply. And if if the patient feels pain or tenderness, showing tenderness, it's a positive sign. It's a positive for Murphy sign. That is, the gallbladder is inflamed.
What is VVM? Vaccine vial monitor.
Sir, vaccine vial monitor is used for to indicate health worker about the temperature of the vial. It indicates in the 4 signs, sir. It will be a square box, and there will be a circle inside. So if the circle is white, it is a healthy while. And if the temperature keep on increasing, it will slowly fade and it will become dark.
Difference between cardiac and pleuritic pain.
Sir, pleuritic pain is related to the lung, which is of sudden or stabbing pain while inspiring and expiring. But the cardiac pain doesn't coordinate with inspiration and expiration. It will be a continuous pain in the chest.
Tell me the different heart sounds.
Sir, heart sound generally of 4, S1, S2, S3, S4. Generally, S1, S2 we will hear in every person. S3 also we can hear in normal person, but it should be of a highly athletic person, like a very active and person. They will have the S3 also. And mostly S3 is a physiological. Mostly S3 is a pathological, but sometimes S3 is also physiological. S4 is a pathological, sir. We will hear in heart diseases or MI. We can hear in S4.
Tell me about dehydration management.
Sir?
Dehydration management.
Sir, dehydration management can be depend upon the person, sir. I mean, how the person looks. Generally, the symptoms of the dehydration will be that means they'll be have a skin trigger will be loose, and they will be having a very severe heart rate tachycardia, and there will be of a drowsy person. And if the BP is on the lower side, we can give the fluids. If the BP is higher side, that means there will be dehydration of different sides. If a dehydration of stroke, sunstroke, we will immediately give the fluids, and there will be of lower side of the BP. But there will be dehydration of vomitings or diarrhea. We will give different type of fluids, sir. Linger lactate.
Okay, hypoglycemia. Tell about it.
Sir, hypoglycemia. The definition of the hypoglycemia is if the glucose in the blood sugar, I mean, if the glucose in the blood level is less than 80, it is considered as a hypoglycemia, sir. But there will be different in the symptoms of hypoglycemic patient in a normal patient, in a diabetic patient. So in the normal patient, it will be of just weakness. In a diabetic patient, there will be severe symptoms like sweating, tachycardia, and heavy breathing, like that. And we will treat accordingly.
Okay, tell me the calorie requirement in pregnancy.
Sir, general women need a calorie of 1900 kilocalories, sir. Normal sedentary woman. And we will add 350 kilocalories for every person in sir. There will be 3 trimesters in the pregnancy. The first trimester we don't need any excess calories, like the sufficient will be 1900 calories. From second trimester, there will be 3 categories of women: sedentary, moderate working, and heavy working. The sedentary will be sedentary. Every woman will be of 350 calories we will add, but there will be different basic calorie they need. That is, sedentary woman, there will be 900 calories. For the basic moderate woman, there will be 2250 calories, and for heavy worker woman, like 2850 calories. We will add accordingly of we will add 350 calories to every person, depending upon their work. And we can also decide by like BMI. If the woman is underweight, we will add 500 calories with 350 calories. And if a woman is normal, if a normal range of BMI, we will add normal calories of 350. If it is obese, we will minus 500 calories.
Tell me about osteoarthritis treatment.
Sir,
osteoarthritis treatment.
Sir, osteoarthritis treatment, no, sir. Sir, the basic, I mean, there will be non-surgical and surgical treatments, and non-surgical mostly includes of analgesics, that is which is a pain reducing. Leading to surgical, we can of osteotomy, and we can replace the knee joints and so on.
Okay, tell about DOTS, DOTS.
So DOTS is a direct observing treatment monitoring, sir. That is, it is used in a TB. We will observe the patient. He is taking the medication or not. That is a DOTS. That I mean, the uses of DOTS can be of we can monitor the patient, and we can also make that is, we can also create the herd immunity.
Okay, tell me about suture material.
So suture material of it can be of non-absorbable and absorbable. Non-absorbable of we will use different types for different areas of the skin and different organs, and the non-absorbable generally used below the skin. Sorry, absorbable will be used below the skin, and non-absorbable will be on the skin. The absorbable will be the silk, and sorry, absorbable will be catgut and vicryl, and the non-absorbable will be silk.
Okay, what is foregut, midgut, and hindgut?
Sir, from mouth to duodenum is a foregut, and from duodenum to jejunum is a hindgut. Sorry, midgut, and from jejunum to sigmoid colon is a hindgut.
Can you tell me about TB diagnosis?
What, sir?
TB diagnosis.
Sir, TB diagnosis can be of, it can be through by sputum test, which is CB-NAT. It is very, investigation of choice, it can be called CB-NAT. And it can also be done by X-rays by seeing the microcalcifications.
Okay. What are the complications of corticosteroids?
Sorry, sir, I couldn't read, but in general, I can say that the complications can be the overusing of corticosteroids can be of the decreasing of immunity and overweight. It can be increasing of weight, and we will. Sorry, sir, I didn't read it. And
okay, tell about pregnancy management.
sir, there will be 4 antenatal visits. And in the first antenatal visit, we will check the BMI, and we will we will do the ultrasound, and every antenatal we will check the BMI, and we will do the ultrasound, and we will check the position of the baby, and we will at second week, at second trimester, we will do the TPA scan, which is very useful in detecting the abnormalities in a baby, and we will and from second trimester second trimester onwards, we will start the IFAs, which is very useful in different. The anemia in India is mostly of iron anemia, and so we will start that iron tablets from after 3 months, which is second trimester, and we will give folic acid also along with, because which is very useful in avoiding the neurogenital disorders in the baby. And from there on, we will check. We will maintain the USG and BMI, and we will, when we go to the third trimester, we will, from the second trimester onwards, we will check the BP and the glucose also, which is a mostly advancing diseases in India, which is a diabetic. The gestational diabetes is mostly more seen in these days. So we will check for diabetes also, and if there is a diabetes, we will put oral glycemic anti-glycemics, and if it is a hypertension, we will see of any case of preeclampsia, and we will put this hypertension tablets also. We don't use normal hypertension tablets in pregnancy, so we will use labetalol like that. So moving on to the second, after completing, we will enter into the third trimester, which is almost delivering the baby. So at 37 weeks, we will do the corticosteroids so to improve the lung maturity, and we will plan the delivery according to the previous delivery, or if it is a first delivery, we will mostly try to do vaginal delivery. If there is a complications, we will try to know priorly, then we can accordingly we can do the delivery at the time of 38 and 39 weeks if possible, mostly after 37 weeks, because in after 37 weeks the lungs will be fully matured, so we will give the corticosteroids at the 37 weeks.
Okay, tell about Steve Johnson syndrome.
Steve Johnson syndrome. Sorry, sir.
What type of endoscopy you use when child swallows a coin?
Sir, it's a laryngoscopy. We will use a laryngoscopy and put the forceps and we'll remove the coin and battery also.
Okay, tell about ethambutol.
Sir?
Ethambutol. Drug.
Ethambutol. Sir, ethambutol is an antibiotic which is used in the treatment of TB. The TB can be managed in two phases. The first phase we will use the two drugs, rifamycin and monoxidil. We will use these two drugs for 4 months, and we will use 4 drugs with later 6 to 9 months, which is the rifampicin, ethambutol, and isoniazid.
Okay. What is UGI bleeding?
Sir, upper GI bleeding can be the UGI means upper GI bleeding. It can be caused by various reasons. Generally, the symptoms will be of the blood vomitings or blood passed through anus, or blood passed through anus mixed in the blood, that is melena.
Okay, tell me hypertension diagnosis.
Sir, hypertension diagnosis, these days hypertension is a common disease and ongoing disease in India. We generally start checking hypertension at the age of, after 25, because the more of stress work, and in India we will start diagnosing after 25. We will check the BPs of the young people, and there is a markedly increasing of hypertension in India, and we will start with generally one drug is not enough for hypertension. We have to manage it too. There is a 4 types of drugs: A, B, C, D. ACE inhibitors, beta blockers, calcium channel blockers, diuretics. So Jenny, we will start with any 2 of this, and if it is not controlling, we will include 3. Triple therapy, mostly we will go to triple therapy. We don't use 4, and we will use if it is a diabetic, we will use separate drug, that is which controlling the diabetic and hypertension. And if it is a CKD, we will use some kind of combination, and if it is a liver disease, we will use some kind of combinations.
Okay, what are the causes of increased JVP?
Sir, it can be of it's generally of 5 reasons. Increasing of preload, that is increasing from lower side, increasing of preload, and it can be of right heart failure. It can be of tricuspid regurgitation, tricuspid stenosis, and it can be of a left heart failure also, and it can be of IgA block. There is a IgA block. They are increasing in the JVP, which is just adjacent to.
Tell about your achievements of life.
Sir, I am BLS certified, and I play karate at a state level, and my papers got published in international journals on hypoglycemia.
What is the work of medical officer?
Sir, as a medical officer, we will work in a PHC or in a medical college. In PHC, there is a OP of 9 to 4, which there we will see various patients, different type of patients, and we will also conduct deliveries in PHCs in a moderate range, and we will go to public also according the family family welfare system. So we will go to the houses, and we will take the data of the diseases occur in this to control the epidemics and pandemics. And we will also have a 104 system, and where there will be ambulance with a doctor. We will go to the areas at sub centers and semi sub centers where there is no PHCs and there is no doctors. We will go to that area, and we will once in a week, and we will check the patients also.